Well, one move the administration has made is loosening restrictions on telemedicine, including visits with mental health professionals. As Heather Sells explains, that's good news for Americans who need help fighting feelings of anxiety and isolation.
There's not a single American who can escape the impact of COVID-19. The result ranges from managing fear and isolation to potentially dealing with the illness and death associated with it. This all affects our mental health, says counselor and assistant regent professor Danny Holland.
One of the things we know is that predictability and control are anchors that people have in order to feel a sense of wellness and routine to their lives. Those things have been dramatically impacted for almost everybody. So there's a loss of that control, a loss of that ability to look at their life and, know where it's going to happen next.
This can be tough for those with relatively good mental health and brutal for those already struggling. The good news, government and professional associations have relaxed restrictions to boost access to online counseling. The Trump administration is expanding telehealth services for Medicare, and that includes providers like therapists. Holland is taking advantage of this move and says while it can be difficult, the benefits outweigh the challenges for most.
People have a very similar experience, even though it can be a little more difficult to get started and get used to. But with the access increased, people can actually sit in the environments that they're having some of the struggles in, and they can work through some of the strong feelings, the thoughts, and the pains that they have right there and be able to have the counselor come right into that environment with them and assist them.
In some regions, groups are making online counseling free to the public during the pandemic. And for college students displaced from their campuses, free online counseling from their schools is often a great resource. It's a sudden shift and asset for the mental health community that's likely here to stay even when COVID-19 is no longer top of mind. Heather Sells, CBN